is Diabetes Awareness Month. And every year seems like, well, every month, the government declares something to be an issue that we all need to be aware of. And the fact that it is officially Diabetes Awareness Month gives us an opportunity to talk about some of the brilliance of the man, Dr. Kedar Prasad. So we have a lot to look forward to with that. We're going to lay the foundation a little bit with just kind of telling you some of the things that set the stage for where we are. We could go through statistics until we're blue in the face. Take a look at them there for yourself, and you can just see exactly where we are. The item on this screen that is, to me, the most disturbing is the fact that there's 53 million that are diagnosed with diabetes. That's the part that, to me, is the most disturbing. Pre-diabetic, 96 million. Just do the math. That's almost 150, just a hair under 150 million people that are in the throes of diabetes. And of course, type 1 diabetes just kind of puts us right there over the edge. That's almost half. That's almost half of all the people in this country. So it's kind of sad. And we all know someone that's in that situation, one way or the other. The cost, completely off the Richter scale. The total, if you count those who people who are undiagnosed, pre-diabetes, gestational diabetes, you're talking 489 billion US dollars. That's what it's costing. That's the impact on the economic system of things. So it's an engine that is running in that direction. So that's why it's kind of relevant for us to be talking about stuff like this. And we're going to see what Dr. Prasad has to say on the matter. We're looking forward to his insights. He's written a paper that helps us to really understand. In fact, he's giving lectures on this all around the world right now, on this exact subject and on the paper that he's written for this. So before we invite Dr. Prasad to our discussion, keep in mind that the FDA has not evaluated these statements, and you'll be hearing testimonials that are purely anecdotal. Results are atypical. That simply means that what happens to one person may or may not happen to you. So the Healthcare Support Association of America, Engage Global, Dr. Prasad, Jonathan Jones, none of the co-hosts or authorized representatives are making any claims that any of these supplements will treat or cure any disease. This presentation is for information and educational purposes only and is not intended to be a substitute for a visit to your doctor. We strongly recommend that you seek the competent medical advice of professionals that you trust. So that having been said, let's talk a little bit to Dr. Prasad. His background is quite extensive. Take a screenshot of this because you need to save this, because when people ask you what's the difference between your micronutrients and my Flintstone multivitamins or my Centrum one-a-day vitamin or whatever it is, you hand them this. You just send them this screenshot right here. This is the man behind Micro Daily, and it's not a multivitamin. It's a micronutrient. It's the food that's missing from our food. Totally different category of any other so-called multivitamin that's out there on the market. And that's what makes this completely different. And so Dr. Prasad, we can't thank you enough, sir, for being willing to join us in discussions like this. We want to welcome you into our discussion. And I want to show people this headline of this paper here that you've written so that people can understand that this is no run of the, what you've done is no less than extraordinary. It's remarkable, to say the least, as to exactly what's going on with you and your continuing to work at the young age of, where are you now, 90, 91, 92?
91, I think, on January 8th.
Well, congratulations on making it that far along. So thank you so much for joining us, Dr. Prasad.
Sure, Jonathan. It's always a pleasure to be with you and our engaged family. And any question they have, and I will try to explain, but remember that whatever we suggest, don't use it without consulting with your doctor. This is a research-based information, And another one I just published has some more on it, just came out in a different journal. I don't know, Jonathan, if I send you the copy or not as yet. But
Well,
any,
I tell you what, I'll bring that up. I'll bring it up and share that piece of information also with folks, because I think you did send it to me, and
yeah,
just didn't quite make it into this
but that's
presentation.
okay. I mean, the concept is very similar, so there's no problem.
Okay. Okay, well, very good. So I tell you what we'll do. Maybe if you don't mind, I'm going to just quickly share one of the testimonials so people can have an idea as to why we're
Sure.
so excited about micronutrients.
And they are, as you know, they have been patented, micro daily EMF. There are two patents. One is micro daily for general reduce oxidative stress, inflammation, and so on. Another one, EMF, micro daily EMF, specifically to prevent the damaging effect of EMF radiation. So there are two patents.
That's pretty powerful and pretty significant. So I hope folks will just kind of understand that we're sitting this is an amazing time to be involved. So hang on, hang on one second here. We're gonna listen to Karine tell her story about her Karine tell her story about her mom.
Oh
And
yeah,
back to
definitely.
talking to Dr. Prasad and why this whole business of diabetes and some of you refer to it as diabesity, why it's so significant to have micronutrients involved in the discussion. So hang on one second here.
Have to say it. So I started, I've been pre-diabetic, and I started the entire supplement last Friday, and my blood sugar been running like 115. Now, since I start using it, it's been like 88. Anyway, I'm not even here to talk about me. So my mom, I'm a nurse, last Friday, and usually if I
Did you
run to
say
open my door, I'm out of breath, and
Karine?
I can
Karine, come
run
on.
half a block without being out of breath right now.
Are you
Now,
saying a week ago Friday or
a week ago, last
Okay, a week
Friday, I
ago
started
Friday.
it.
Uh-huh.
But what I need to tell you, what I didn't even tell them in the hospital, my mom is in the hospital. I took her to the hospital Friday morning. Congestive heart failure. She's also diabetic. And she has chronic kidney stage 4. So she has all this fluid on her. They put her in MSICU, and she's been having a lot of problems. I was scared to death as a nurse, thinking I'm going to lose my mom. Difficulty breathing, her lungs filled with fluid and all that. Anyway, I said, I want to try it. I want to try it on her. But then I'm like, oh my God, should I not? So I went to the hospital and I mixed 4 capsules of the micro daily in the applesauce, and I gave it to her yesterday morning. Now she wasn't peeing. They're thinking diabetes. They're thinking dialysis because her kidney functions are way, way off. I'm like, oh my God, I can't give her dialysis. Now, I kid you not, within 5 hours of me giving that to my mom, now they had put a Foley in her because they want to see if the urine output was coming. They're like, we don't see urine, maybe she's retaining. Now, within 5 hours, that urine, that bag had 800 liters of urine in it. I kid you not. Now, I wanted, then her hemoglobin was a bit low. So the nurse said, is she anemic? Yeah, she is. So they said, and they kind of tugged the Foley a little bit. So there was a little bit of blood. So they did a hemoglobin to see what her blood count was. Now, with the bleeding, her blood count should be lower. Her blood count went up by 2 points. 2 points. I kid you not. Then, my mom, she's been sleeping ever since I put her in the hospital, sleeping. She would open her eyes and go right back into a deep sleep. When I went back to her yesterday, she was up singing. All last night, she was peeing like rain. All right, in the Foley catheter. I went back this morning because she's in MSICU now, and they're saying, hey, they're asking me, is she full code? Yes, she's full code. All right. I went back this morning and I gave her another dose. The cardiologist, they called me and they said she might go home Tuesday. So the nurse, they did a urine culture. They were like, oh, we gave her some antibiotic just to make sure. But she just turned around, a full U-turn back to okay. So we think it's a dose of antibiotic that did it. But I did not tell them what I did because I wasn't supposed to do it. And I'm a nurse and I work at that hospital. So I couldn't tell them. But oh my God, I just had to say it. I am driving now to go give her another dose. And I just had to say it because I tried it so I could introduce it to my patients. But when I see what it did to my mom that I thought I was going to lose, I'm like, oh my God. So
Karen, that's
my
wonderful.
story. I don't even want to talk about me right now. I'll talk about me another time. But this just helped my mom. Her kidney function, her BUN and creatinine started going up to the normal level. It's not there yet. It's going up, going in the right direction. Her blood glucose, because when they check it, it was 244. When they check it, it was 118 again. Oh my God.
How old is your mom, Karen?
87.
Wow.
87. And now, nice clear urine coming out. That wasn't coming before. They were setting up dialysis for her. The doctors is like, oh my God, okay, she's doing very well. We don't know. The nurse is thinking it's the antibiotic. It was not the antibiotic.
Antibiotic is amazing. Yeah, just amazing.
It was the microdaily that did it.
Which formula did you give your mom? EMF or original?
Yeah, the red label.
And you gave her
four. I gave her 4. Yes.
Karen, your story will undoubtedly help a lot of people because
oh my God. I am a nurse. I'm almost a nurse practitioner. And wow. I was a bit hesitant to give it to her. But I'm like, you know what? They're telling me my mom is doing very bad. I'm just going to take my chances. Oh my God. That's right. My mom sang a whole hymn this evening to me.
Wow. I'm going to stop it right there. So Dr. Prasad, maybe you could, before we just go into some of the slides that we want to talk about in your paper, could you maybe tell us a little bit about how it is that diabetes is connected to kidney disease like that and why a person could head toward dialysis and being in that situation?
Yeah, I think, again, the crucial point here is that what causes the initial problem, which is increased oxidative stress and inflammation. And she must have gone under extensive one, not only that, but also don't forget about the role of intestinal dysbiosis, which produce a lot of toxic chemical, which further aggravates her conditions. And third one is also that the reduced secretion of insulin from pancreas to the blood because of increased the enzyme DPP-4, which destroys GLP, that is responsible for the secretion of insulin from pancreas to the blood. So I think this is so important that at least even just the microdaily alone, that tells me that oxidative stress and inflammation, and because intestinal dysbiosis also produces terrible things, but they get all corrected because of the microdaily, which reduces oxidative stress and inflammation at the same time. It's very important to remember. Not many agents can do that. They can reduce inflammation, but not oxidative stress. But for this kind of success, you have to reduce both. And then since she was not doing anything, the disease continued to progress. And then you have damaged diabetic-related neuropathy, and nephropathy means kidney damage, and other kind of problem, all related to increased oxidative stress and inflammation. And if you have not done it earlier, obviously, then they will continue to progress more severely. And then the end result is dialysis and all kind of problem.
My goodness, that's incredible. It sounds like a mouthful, but the bottom line is
it's simple.
Yeah.
Reduce oxidative stress and inflammation in your body and reverse the effect of intestinal dysbiosis. You have to do at least only those two things, you are in good shape.
And it really does sound like an oversimplification of it, Dr. Prasad, but we're impressed when we hear it. Your paper is saying a mouthful.
Yeah.
But you want to talk a little bit about, what a person.
Yeah, here is first we have to remember why people get current, because there is no prevention strategy right now. Only prevention strategy is okay. Yeah, poor diet, lack of a physical exercise, high blood sugar. We have been talking about these things for ages. Has it affected the incidence or prevalence? No. Why? Because two things. Human behavior with respect to diet, lifestyle, and environment reducing is difficult to change. Few people will do it, but we continue to educate them, but they don't follow it. Second most important thing, none of the factor that we recommend for prevention is the reducing all the risk factor that you are talking about. And none of them have reduces internal stressor, namely oxidative stress, inflammation, intestinal dysbiosis, and some other factors. So therefore you don't have any effect. Diabetes continue to increase.
Wow. So you're basically saying then that even if a person became completely athletic, they ate the
Yeah,
perfect foods, if they did all the right things.
they don't do, yeah, and still you will have some valuable if you follow 100%, you will have some effect, maybe delayed, but not total effect, because
Mm-hmm.
these things do not address as efficiently as we like to, as we propose to do that. And
Mm-hmm.
so, but we see how many people will follow that. Nobody
That's
follows.
right. That's right. Very few people actually follow through on it. But either way, they need to do something
And
to deal with
diabetes
the
type
oxidative
1
stress.
is,
Mm-hmm.
is another very type 1.6 million people, and that's a lot of people. And type 1 diabetes is first, it is a genetic, but also it could be that if your pancreas get damaged by infection, say, any kind of infection, then they can produce insulin. And if they can produce insulin, then it can metabolize glucose. They
Mm-hmm.
accumulate in your blood, and then you
Mm-hmm.
get diabetes. So, and then there's sometimes you have a production of autoantibody. So no matter what happened, they all, whether your family history, injury to pancreas, they all damage pancreas. And when pancreas get damaged, they don't produce insulin. And if they don't produce insulin, then glucose cannot be metabolized. So what
Mm-hmm.
happens? So first you have to understand how the glucose gets metabolism in your body under normal condition. So when you eat diet, food, anytime, food, lunch, dinner, the glucose got high in your blood. It sends the message to pancreas, I need some insulin. So pancreas says, okay, if it's functioning normal, they say, okay, I will send the insulin. When insulin goes there, insulin then binds with the insulin receptor. And the insulin receptor then has a molecule called signal molecule AKT. They get activated. But binding is very important. Bind it, and without binding, it cannot get activated. And when they get activated, they send a signal to glucose transporter 4, which is lying in the cytoplasm. You better go and migrate to the cell surface. And then they go to migrate to the cell surface membrane and then allow glucose to come in for generation of energy. So this is the normal way your body works. But what happens? First, what happens? If your body has increased oxidative stress, first thing they will do, they will damage insulin receptor.
Mm-hmm.
So now insulin receptor is there. So you have ate food, now glucose. He's sending insulin, but insulin receptor is damaged. So glucose cannot be allowed to come inside the cell. AKT molecule cannot be activated. And so that you can see how important is the oxidative stress. And so the question is, this is one thing. And an oxidative stress also can damage directly pancreas. It can increase the activity of the enzyme, what is called DPP-4, which
Right.
degrades the hormone that allow secretion of insulin from the pancreas to the blood. So these are the defects that how we can take care of that. It's very easy to take care of that. But this is the current prevention issue do not even address these kind of issues that we are talking today.
Well,
So,
current treatment and
and
prevention.
current treatment, all in human diseases,
Yeah,
including diabetes, they treat the symptoms of the disease,
all dealing with
not the
symptoms.
causes of the disease. And causes
Yeah.
of the disease increase oxidative stress, inflammation, increase in a DP4 enzyme and dysfunctional omega-3. And so if you don't care these things, you will have some benefit of current treatment, but the disease continue to progress rather slowly. And
That's right.
if you become resistant to one drug, they change to another drug, they change to another drug, and they continue to progress and finally develop all kind of diabetic-related complications like nephropathy, neuropathy, peripheral neuropathy, and eye disease, kidney disease, nerve disease, and so on. And so it is so simple. I mean, that's what amazes me, that not many people follow it. And
Yeah.
this is all published information. I'm not trying to make it up. This has been known for ages.
It's
It is
been
not a
known.
new phenomena that I discovered.
Well, I'd love to just ask the question as to why it is that the information does not seem to hit pay dirt, but we're going to focus so much more.
Because see, these kind of things conflicts with the drug industry. And they will make sure that you never go in the market. And these elimination that we are talking about is, patent is okay, but until it gets FDA approved for treatment of diabetes, like we have Core 4, until they approve for the treatment of diabetes by the FDA, you are not
Right.
going anywhere.
Right.
And
Right.
I think, and as you know, it costs money. And so that is the way you can protect against the drug company. But in this case, there are so few people, drug company says, let those guys, there are few people there.
Yeah. Well, we just hope at some point that it will make some headway. And we've got folks here. There's 116 connections on this meeting right now, and
Yeah,
they're learning that there is absolutely something that they can do.
yeah.
So even if a
This-
person is
this-
type 1 diabetic, Dr. Prasad, will
yeah,
micronutrients benefit that person? And
I know, like you right here, type 1 diabetes. You can't give any drug because they don't have insulin. And so you have to give the insulin. So when you have a type 1 diabetes, when they get diagnosed, they start with insulin. Okay, so it works very well for a short time. But still, many patients develop insulin resistance because they keep increasing the dose of the insulin. And many people survive for a long time. Insulin is very good for type 1 diabetes. But if suppose you develop 10%, 20% of people develop insulin resistance, whether it's diabetes type 1 or diabetes type 2, then what you do?
right.
Well, there is a mechanism. Omega-3 is the only agent which can bypass insulin receptor and directly activate AKT molecule, which then tells the glucose transporter 4 to migrate to cell surface and allow glucose to come inside the cells. That's the only agent. That's
Wow.
so simple, but they will suffer it. And if you don't do anything and you develop resistance, then you develop neuropathy and all kind of eye disease, kidney disease, and so on.
So you just said that omega-3, the right formula, of course,
Yeah.
activate ATK or
Yeah, AKT, yeah, directly, without going through the
direct.
insulin receptor.
So if a person is insulin resistant,
Yes,
this would be the best thing that they could put in their body.
exactly, exactly.
Wow.
I mean, it is so simple, and it is again, I have not discovered this. It is already there. I'm just bringing up to your attention.
Well, people need to hear this and they need to hear it clearly, Dr. Prasad.
Yeah,
So for our audience that's listening right now, Dr. Prasad just said a person is insulin resistant. So let's say it's a type 1 diabetic, that omega 3 can activate and basically tell the cells, allow glucose in, even if a person is not responding well to insulin.
yes,
So they need to have this in their body. So really, everyone should. Type 2 and type 1 diabetics should have this, especially
exactly.
type 1 diabetics.
Yeah, not only that, even suppose you are taking insulin, suppose you are taking insulin, and that is
Mm-hmm.
helping you out. But if you take the omega-3, it can double help you and quickly so that you don't have to increase the dose of insulin once you become slowly resistant to, because then it can act both way. Insulin is working to do it, and the omega-3 can directly activate it, does the job of insulin in a way.
Yeah,
You see what I
wow.
mean?
That's powerful. That is powerful. And I think everybody needs to really fully understand that.
Know it, that it is, if you have insulin resistance, you have no other choice. You just sit down and use some other kind of medication, but it doesn't do any good.
That's
And
right.
so
That's right.
the only thing can do extremely good is omega-3.
Wow. Well, tell us a little bit about how the collagen peptide has an impact, because there was a double
Yes, collagen
blind.
peptide is initially collagen peptide. I put two herbal products. One was amla extract, and another was white the white tea extract. Those two, and initially I put it to reduce the activity of the collagenase enzyme, which was destroying collagen. But certainly, some people say that it is also helping to improve the insulin secretion. So I said, I don't know. So when I did some literature search, we found out that these two, amla extract and white tea extract in our collagen peptide, has another function. It also inhibits the DPP-4 enzyme, which destroys GLP-1 that allow secretion of insulin from pancreas to the blood. So that's why some people were getting benefit when they combine the collagen peptide with GLP boost, and other people who are not, because the DPP-4 enzyme can vary level. Some people can very high level, but this does a small amount. So our new product of GLP-1 that we are developing it will have a inhibitor of the DPP-4 enzyme, and the herbs that I have added it inhibits 100%. So you will have a much more effective GLP in terms of glucose metabolism.
Well, that's beautiful too. I tell you what, you've shared a mouthful with us here. Tell us a little bit about this
Yeah, this is very interesting.
little study.
Yeah,
Also,
this was a clinical study. And they did this, and then they found out only collagen peptide they did, and so they found that you can see that fasting glucose was 125, collagen peptide plus drug group becomes 105. So it is decreased. Then A1C was 6. Then collagen peptide, when you combine with the medication, it became 5. Insulin resistance decreased from 6 to 5. So collagen peptide has a lot of benefit in terms of
this
diabetes.
is
So that's
this
why, in summary, is the core 4 that we have. That means you take collagen peptides, you take omega-3, you take intestinal probiotics, and microdaily EMF. These core four, you will be happy for your entire while you are aging, good quality life. And you can do it at any age, at any time. There is no time limit.
This is powerful, Dr. Prasad. Absolutely mind numbing.
So simple. And also that, like you always say, Jonathan, that you follow good lifestyle, good food, good lifestyle, exercise, and less sugar. This kind of do that we are recommending for ages, do it if you can. But if you can't do it, at least you can try it and use this simple thing, Core 4.
You know, and I think that if folks just kind of wrap their mind around it, this is a published paper, folks. This is a published paper.
Yeah.
It's been accepted in the scientific jargon, scientific medical publications.
Yes.
This is not just some hypothesis of Dr.
No.
Prasad's around the entire medical community.
Yeah, it is all quoted. Every statement I make, I'm making it has a reference in it.
So we're going to share a link to this in the description on the recording, so that folks can download the actual document if they would like to get access to it, so that they can have it as a reference as well. So I tell you what we'll do is we've had some more amazing stories of people who've benefited from using the Core 4 and one way or another with their diabetes. There's 122 connections here now.
Wow.
Let's just see. I would wager that there's someone here right now on this meeting that has that would like to share their story,
Sure.
specifically about diabetes. If they don't, I've got one or two more that I'd like to share. But I would much prefer that if someone's here right now. So if someone has had results and they're diabetic, and you've been using the Core 4 and would like to share your story, now is your opportunity to do so. So we got Tammy Shelby. She threw her hand up there fast, and sometimes you get a little worried when they throw their hand up there fast, Dr. Prasad. You just kind of wonder now what we getting ourselves into. But please, Tammy, go ahead, share your story.
Well, when I began taking the Core 4, my blood sugars were 9.8, and that was my A1C, was 9.8. 3 months after taking the Core 4, they went down to 7.4. The last time I went to the doctor, they were at 6.1. So in about 3 weeks, I have another appointment to the endocrinologist. But what I love about this is that through all of this, my blood pressure has leveled out. I'm no longer on my blood pressure medicine. And also my cholesterol has dropped significantly. He was shocked when my doctor said it, you dropped 16 points. And he's like, that was just in a short amount of time. And he says, what are you doing? So I made them put in everything I was taking. And I specifically said, Dr. Prasad's Core 4, and I gave them everything with it. And I made it. So when I look on my medical sheet, it lists what I'm taking. So my weight came down as well. And Jonathan's right. You got to get off the couch. So, walking has been something that I've been trying to, improve on, but I'm looking forward to seeing what this time when I go back in a few weeks, what my A1C is going to be.
So what doctor says?
This is my endocrinologist.
Yeah. Okay.
Yes. And my medical doctor took me off of the blood pressure medicine. Yeah. And yeah.
So he was not surprised or
he was shocked. He couldn't believe it. He said in the 9 years he's been treating me, this is the best health that I've been in overall. Everything is in the green. And the only two things that still was concerned was the A1C and my cholesterol. But he said the way that it's coming down, he can't wait to see me in a few weeks too. I got one day, and 2 days later, I got the other doctor appointment again. But he said he's looking forward to seeing what my cholesterol levels are, because that just amazed him.
That's good.
Yeah. Thank you. Thank you. Thank you very much. I appreciate everything you've done.
My goodness, Tammy, thank you very much for sharing.
Jonathan, I have told you about Maverick trial we did in Denver among firefighter, right?
Yes, tell us about the that Margaret trial.
Yeah. This was done in collaboration with the Dr. Boone, who is a cardiologist of Bronco football. And as you know, that firefighter have increased risk of heart disease. So we started at that time. There was no microdaily EMF. It was the original microdaily. So he did it. He recruited I think 35 people in a group that they will take just alone the microdaily alone, and another group was getting the Lipitor type of medication, different types of Lipitor, and then and he was measuring two criteria. One was the lipid profile, cholesterol, HDL, LDL, and so on. And another thing he was measuring is that nobody does it, is the thickness of the carotid artery. As you grow older, carotid artery plaque started forming it. And plaque started forming it, then becomes narrow and narrow, and then it can interfere in your blood supply to your new brain and can develop Alzheimer and all kind of problem. And so,
Very bad.
yeah, and any kind of vascular dementia, there is also called vascular dementia, which is like Alzheimer. So he measured 6 months and 1 year. Then he found that after 1 year, then compared the results, he said that the lipid improvement in lipid profile in cholesterol and high HDL and LDL is exactly same as Lipitor. So he started calling microdaily as poor man's Lipitor. And then another thing which is unique of microdaily that Lipitor did not do it, that Lipitor continued to increase the plaque formation slightly, and he measured it by ultrasound. So it is all measurement, not just guessing it. And they found that the group who were taking a Lipitor type of medication, they had some increase in the plaque formation in the carotid artery. But microdaily one, zero, none.
Wow. Wow. That is absolutely phenomenal, Dr. Prasad. And I think
That surprised me myself. I developed the product, but I did not expect that kind of situation.
but this is proof that if a person is looking for a way to have minimal side effects and
Yeah,
maximum positive benefits from something,
yeah,
this is the way to go. Go with the
exactly,
4-4.
exactly.
4-4 could be the ticket for someone
Yeah.
dealing with diabetes.
And
I mean,
they were young people. They were like average age was 35 years.
average age
And
35
imagine
years.
if you don't intervene earlier, they could have developed all kind of problems.
Oh yeah, those are strokes and
Yeah,
heart attacks waiting to happen right there.
yeah.
Yep, absolutely. Anybody else that wants to share their story? So Tammy knocked that one out the park. But if you've had some benefits from taking the core 4 with your diabetes, we're on Diabetes Awareness Month. We want to hear your story. And I don't see a camera for Fulvia, but we have Fulvia Esteban that would like to share her story, Dr. Prasad. So let's see if we can't get.
Okay.
Here Fulvia is available to be visible. Go ahead, Fulvia. Please tell us your story.
Hello, everyone. Diabetes journey has been a long one for me. I started with an A1C of 12.
Wow.
Wow.
Yes. And as a result, I have incurred what is it called? Diabetic retinopathy.
Yeah.
Yeah.
Currently do. But it's gotten a lot better, even with the injections and whatnot. It's gotten a lot better. But as of the 30th of September, my A1C is now 6.6.
Wow.
Hmm.
And I take everything but a sleep boost.
Wow.
And I'm going to take these products till the day I die. I will not stop taking them. It's done too much but good in my body. It's brought life back into my body. How can I stop? I cannot stop. No way. Thank you, Dr. Prasad, and thank you, Jonathan, for allowing me to share.
Wow, Fulvia,
Thank you, thank you, thank
Yes.
you.
that is incredible. Can you tell us what impact it's had on your life and how do you feel as a result of this improvement?
Well, I went from not being able to do for myself that I can do for myself now. I don't have to wait on my kids to come and fix not even my breakfast, my lunch, dinner, nothing. I can get up and do. My body don't have any more pain. My body used to rack in pain from my head, back of my neck, both my shoulders, both my hips, my knee, my feet with neuropathy. It's all gone. It's all gone. So
Wow.
I know with the vision, it's just a matter of time. That's coming around the corner too.
That's right. That's right.
Yes.
Wow.
And I've also changed basically the way I was eating. I thought I could take these supplements and these formulations and didn't need to change anything else. But if you have that in your mind, I'm telling you right now, you're wrong. You have to change everything and get your body moving. If not, you are still going to be in trouble. I found out the hard way, so I can tell you move your body, change your eating habits, and take these amazing formulations. You will not be disappointed. I promise you.
That's beautiful. Fulvia, thank you
Yes.
very much for sharing your
You're
story.
welcome.
Oh my goodness. So Dr. Prasad,
Yeah, again, is beyond my imagination dream that this kind of result it will produce it. I mean, you do your best you can, but you don't know the results. But when you see this, I will live 5 years more than I was estimating to live longer. With this kind of a story, I get so much energy and happy that it will
right.
increase my life extension.
That's right. That's right. No, it's a beautiful thing. We're talking, she went from an A1C of 12, Dr. Prasad, down
I
to
know.
an C of 6.
Yeah.
You know, that's right
And
in line with what Tammy
I mean,
experienced.
nobody will believe it. You tell you, say, oh, yeah, you are making it up.
But in her mind, it's not being made up because her entire life has changed. Her body has
Exactly.
changed. Her pain levels changed, and the independence that is given her, Dr. Prasad. I mean, I think that's the part that's excited me the most. Is her regaining independence.
Yes, it's very important in life while you are growing.
Wow, that's amazing. That is
Look,
amazing.
in spite of my accident, serious accident it was.
Yes.
I was immobilized for about 8 weeks, but now I'm functional. My brain is working now.
Yes, it is. That brain hasn't missed a beat, so we're happy about that. So thank you very much for that one. But we do want to tell everybody remind everyone what Dr. Prasad said earlier. This is not substitute for a visit to your primary care physician. So please make sure you seek the competent medical advice of professionals that you trust. Testimonies are anecdotal. What happens to one person may or may not happen to you.
Yeah.
We have time for maybe one more if you'd like to share your story. And we may even have time for a question or two if diabetes related. If it's diabetes related, we want those questions now. This is Diabetes Awareness Month.
Okay.
So you can slip that in now if you would like to. Roberta Rice. I was going to share your story too, Roberta Rice, but that's okay. She wants an update. So, and by the way, this is all live stream. So for those of you who are joining us on YouTube right now, thank you for joining us. Please feel free to like, subscribe, and share. Post your comments down below, and it makes the algorithms for YouTube recognize that this content has value. So because you can always get it on YouTube. YouTube.com/Jonathan Jones is the easiest way to get access to the recording, the live stream recording. YouTube.com/Jonathan Jones. Okay, so right now we don't have any questions that are related to diabetes or stories that want to be shared. Ed or Joyce Howard is trying to slip something in here. Is this a question or a story you want to share, Ed or Joyce?
A question
Okay, let's pop in.
on diabetes related, yes.
Okay.
Maybe you could give a little pointer on the diet that the last the last testimony used, how she changed her diet. We know Dr. Prasad's diet, what he's suggesting, and are there some other things that he'd like to add as far as what can be done as far as diet to speed along the process of improving the diabetes?
Yeah, I mean, diet is very well known. People have been suggesting it. You take a good food with fresh fruits and vegetables, low calories, and also low fat, and reduce amount of glucose, and do a lot of exercise, physical exercise every day, 5 days a week. And also, it is very important to reduce the exposure to environmental agent, because some of those environmental agent particles, if you breathe it, that increases the risk of diabetes. So it is very important to also reduce. But many environmental agent is beyond our control. We can control the environment. Some area is more, the area is less. So, so try to do as best as you can, the one I suggested, but also use the core 4. Then you will have a good time, good lifestyle, and good effect.
Very good.
Yeah.
Thank you.
Thanks very much.
Thank
Appreciate
you
that.
for your question, Ed. Much appreciated. And if anybody wants any more specific, diet related adjustments or recommendations, you can just send me an email, eg at jonathanejones.com. And I will be happy to send you some. It's my email address in case you are requesting information about diet and things like that. We can share a suggested diet for you as well. Okay, so while you guys are thinking and maybe trying to decide if you have a couple more questions you want to ask, we're going to just kind of take you through the last part of our slides here. This is a summary of Dr. Prasad's recommendation when it comes to a prevention and improved treatment of diabetes type 2. So remember, the core 4 is really at the heart and soul of the recommendation. Make the adjustments in your lifestyle. Of course, that's all very important, but bar none, this puts a person in a much better position. We will share a link to the to Dr. Prasad's published paper. This is the newly patented formula Dr. Prasad has now been awarded for the EMF. It's the core 4 that you see there at the top and the basic bundle. Those are the main bundles that Engage Global has for us. These are the ingredients from the micro daily. As you can see, it doesn't appear to be anything spectacular, except that remember, it's got the brilliance of Dr. Prasad behind it. That's what makes this special. His unique formulation makes it very, very special, and it works. This is his probiotic. There's the ingredients panel there. Dr. Prasad chose a lot of the heat-resistant and acid-resistant strains of bacteria.
Yes, that is very important, John.
So that means that these bacteria will make it where they need to go. So prebiotics and probiotics and prebiotics are included here. So you got the right combination of them, perfect for addressing intestinal dysbiosis that we all experience, by the way. So no one is exempt from this. So you can get that as a bundle here for about $110 if you are on a budget. But remember, it's the core 4 that Dr. Prasad recommends. And we can't say enough about this collagen peptide. This is a patented product as well.
Fantastic.
This is patented.
And also, Jonathan, the core 4 has been submitted for a patent.
And the core 4 has been submitted for patent.
Yes.
Yeah, that's beautiful. That is beautiful. So you think about it, folks. This is not a run-of-the-mill product. And remember what Dr. Prasad said earlier. This has the enzyme inhibitors.
Yes.
So you don't just make collagen with these peptides, you keep what you make.
Yes.
All the collagen peptides out there you're bleeding out collagen as almost as fast as you make it because your body's producing enzymes that degrade it.
Yeah.
But Dr. Prasad's formula, you keep what you make because it has enzyme inhibitors that stop you from degrading your collagen as you make it. So it doesn't matter how cheap it is at Costco or any place else, it is not worth the bottle that is packaged in. This is the only one that you should be using for a good reason. And Dr. Prasad's omega-3 formula is unique. So this is unique. Don't think that it's the same old run-of-the-mill. He put the right amount of omega-3 versus omega-6 because you get so much omega-6 in our diet. Dr. Prasad has told us you don't need as much. So he's reduced that amount, put in the EPA, put in DHA, and the man added, and GLA, don't forget about that one. Great for the brain. But he also added borage oil. So diabetic, if you have neuropathy, borage oil is your friend. Dr. Prasad added it to this formula to make sure that it was there for you. Digestive boost, also great for diabetics because most of us don't chew our food enough. This is like putting teeth in your gut and helps your body to process the foods that you consume.
Yeah, because this is true. As you grow older, this is nature. Your body capacity to produce digestive enzyme gradually decreases. So it is essential if you are an older person to substitute it with digestive boost.
There we go. Get a good night's sleep. CBD boost will help you with
CBD,
anxiety and stress.
Magic one.
Yes, anxiety and stress. This is just phenomenal for that. No question about it. Brain boost, if you're having a little bit of brain fog, you want to make sure you add a couple of these. My normal protocol is 2 of these in the morning and 2 in the evening. That's just my thing because it makes me feel like I had a double shot of espresso and fires me right up. The sleep boost, especially for diabetics, you've got to be able to have a good restful night of sleep. Your body heals when you've had 7 to 8 hours of unbroken sleep. So you might want to add this to your regimen as well. So remember, the core 4 is the foundation of it. The person who invites you can help you to add all the additional components to your order to make sure that you have what you need. Engage Global subsidizes a subscription. So if you are on a subscription, it's being subsidized by Engage Global. If you were to buy this off the shelf, there'd be $310 or more. If you bought it as a distributor, like many of us are, it will cost you about $250. But because you are a preferred customer and you buy it as a bundle like this, it's just around $200. So Engage Global is subsidizing your health. So you just can't get around it. You're in the right place, and you have people who care about you. They care about you. So get back with the person who invited you to this discussion, and they will help you to put the order together that is right for you. And if you want help paying for it, they can even introduce you to mechanisms whereby you can make referrals and actually get free product. It's possible for you to get free product just by making referrals. Engage Global wants you to benefit from this. So as we say quite often, as Dr. Prasad has said, please do not expect a pill, potion, or lotion to do for you what you could do for yourself. Fulvia just reiterated it for us. Get moving. Change your relationship with your couch. Get moving. Instead of parking as close to Walmart or the store that you go to as possible, please park as far away as you can. Get moving. Everybody needs to get at least, if you can get 7,000 steps in a day, that's a good goal. If you can only get 1,000 steps in, do that. Get any steps in. Get as many steps as you can. But there's clinical studies showing that 7,000 steps a day is perfect for a diabetic if you want to help your body and improve your quality of life. So, Dr. Prasad, we can't thank you enough once again, sir, for all that you bring to the table for us and all that you share. It's truly enlightening. We appreciate what you are doing for the entire world because the planet benefits by virtue of the fact that you're sharing this knowledge and you're publishing this information and giving these lectures all over the world. 91 years old and giving lectures all over the world and still taking everybody to school. It just does not make any sense. I'm sorry, I just have to say it that way. It doesn't make any sense, but we thank you, sir, for all
Thank
that
you. It's always pleasure to be with you every Sunday and talk something new.
Yes, and every time we learn something new, we have little sessions where we call our aha moments, and it's always filled with new things that someone has learned from your presentations. Next week, Jeff Ashby is going to be, I think it's Jeff Ashby on next week, but either way, next Sunday, another very interesting discussion will be provided, so you can feel free and take that one to the bank. You guys want to unmute yourselves? You can feel free to say goodbye to Dr. Prasad. Thank you again, sir. Thank you, Fulvia. Thank you, Tammy, for your stories.
Thank you, Dr.
Thank Dr.
Thank you.
Prasad.
Thank you,
Thank
Dr.
you.
Prasad. Thank
Thank
you.
you so much, Dr.
Appreciate
Prasad.
it. Like the
Welcome,
testimony.
Prasad.
Dr.
Thanks for your
Prasad.
help.
Thank you, Jonathan.
Thank you
Thank
so
you.
much.
Thank
Thank you very much.
Good job, Dr. Prasad. Good job.